past experience in the field of social work is actually in medical social work or health social work as they call it now. Basically, we're doing a lot of casework with individuals and families, and the impact we have on them is actually through the kind of psychosocial support that we give. I think the instances when we are able to see the patient through the whole treatment form and find that they are able then to recover or to cooperate with the treatment, I think that itself brings a lot of satisfaction. But in my line, I have worked through different clinical areas, and one of the impact we have made is like being able to set up a support system for cases of rape and sexual assault, where we work together with other professionals from psychological medicine, from gynecology, from pediatrics, and we were able to set up a system where victims of sexual assault and rape are able to be given privacy when they come in to report the incident, that they are taken to a dedicated room where they are given special attention, they are sort of prepared for gynecological checkups and all that, and we continue to see them for supportive counselling after that. And I think that has made quite a bit of impact because we did it like a 24-hour service. So issues like that, the social worker has a lot of impact, has a lot of contribution to make. They don't see it as just dealing with the individual, but also dealing it at a more macro level, that you can actually change or initiate policies or legislation. You can actually initiate the services and programs that are lacking or not efficient enough, like home nursing service, or care for the mentally ill. I think social workers in those days, I know we actually work very closely with NGOs like the Malaysian Mental Health Association. In fact, the founding members of many of these NGOs actually involve social workers from the hospital. We actually work on home nursing and daycare centers, rehab centers, special education for children with mental retardation, So these are the kinds of issues that makes it very exciting work for social workers, and I think there's a lot to be learned and a lot to be gained actually if you do social work in this health field. And I have no regrets actually. It's been very, very satisfying, and I've been in that line for 20 over years, but I still continue to work in terms of individual kind of support systems. Okay, what I see is that there are many young people who actually have very good intentions of wanting to help others, and I see them volunteering their services in many NGOs, in church-based organizations, even in churches or temples or in mosques. They are all trying to do something good and they want to contribute. But I feel that if they could actually get into this kind of a proper training for social work, they would actually be much more effective. They would actually be happier about how they can help people. Because when you go in without any kind of knowledge, values and skills, without any idea of how to help, actually sometimes it can cause a lot of emotional stress, it can cause burnout, and then you might decide that this is not something you can do, or you get discouraged, because you feel that you're not doing it well, or you're in a way disappointed with yourself when you find that people don't respond to you the way you want people to respond to you. But when you actually get into this social work education program, you will learn a lot more. You will understand how people behave and why they behave they do, and that helps you to actually deal with people in a much more professional way. So I would see that there is a lot of potential in young people who actually are interested in helping to make this their career, because a lot of times we see that they rush into other careers, right? But when they reach their 40s, 50s, then they suddenly decide that that's not what they want to do, and they move into the social work field of practice actually. So then they struggle also because they do not have the background. But we are seeing that in our students, actually the students who come to our diploma in social work program, the ages are ranging from like 19 to 55, So anybody actually can take up social work, but the important thing is to get the right kind of understanding, the right kind of information, the right kind of knowledge, and the right kind of skills as well, so that you can work professionally, logically, rationally without getting stressed out, without getting yourself burned out. So it's important, for young people that if you want to come in, then do it the proper way, do it the social work way.